Due to lifelong eating and lifestyle habits that contribute to diabetes development, seniors are at a greater risk for developing type 2 diabetes.
Today, we are joined by primary care provider Schadrey Bonds with some great advice for seniors managing their diagnosis. Good morning, Schadrey.
Good morning.
Well, it's great to have you. So before we kind of dive into managing diabetes, let's talk about what the disease is and the different types.
So diabetes is a lifelong illness. There is type 1 and type 2. Type 1 is usually diagnosed early in childhood or early adult and is an autoimmune where your body's immune system attacks the cells in the pancreas that produce insulin, so you no longer produce insulin. Type 2 is the most common type of diabetes, usually diagnosed later in life, is usually a result of people's bad lifestyles, but it can be hereditary. If family members have it, you're at higher risk.
So you mentioned the hereditary and are there any specific causes for both types of diabetes?
So type 1, again, autoimmune. Type 2, you're overweight, smoking, stress, lack of exercise, and then again that hereditary component.
Now, what are some symptoms that someone might experience if they have this?
Symptoms of diabetes can be kind of vague. You're not exactly sure what's going on, but you can feel unwell, you can feel tired, thirsty, hungry, you can be urinating more, and then feeling shaky or just unwell, and it's very vague.
I mean, you talk about the vagueness. Are there any other symptoms or ways of people knowing that they might have it? Would they feel slightly differently? Should people get regularly checked up for it? What are the best ways of preventative or taking care of if you're worried you might have it?
Yeah, the best advice I can give if you're not feeling well or you're even a little concerned that you may have something going on is to talk to your primary care provider. There are screenings for diabetes. The most common that you hear of is the A1C, which measures your sugar over a period of 3 months and tells us how your sugar is being regulated by your body. But all these screenings are available in your primary care.
Now, what are the ways that if someone is diagnosed that they can manage diabetes?
Sure. Diabetes is managed through a couple of things: diet and exercise, taking medications once you're prescribed, having conversations with your provider about what works as far as medication regimen, and working to kind of check your glucose, understanding what you eat and how it impacts your glucose so you can plan around that.
What do you say to someone who might be concerned that they can't afford treatment or don't feel they have a provider?
So there are lots of healthcare plans and health plan partners with P3 that offer insurance plans that are inclusive of diabetes, meaning they offer free care for diabetes, things like free primary care visits or screenings are covered, and your medications or your glucometers are covered by your insurance plan. And those insurance plans, there are numerous of them, and a lot of them specialize towards chronic conditions like diabetes.
Now, before we go, talk to us a bit about P3 Health.
Yeah, P3 is a primary care, a clinician-led and a patient-centered primary care group here in the Valley. We have 11 clinics, P3 Medical, and then we have 400 affiliate providers in the Las Vegas Valley.
Okay. Where should people go for more information if they want to connect with you or if they have any other questions?
Yeah, p3mv.org.
And is there, before we go as well, is there maybe a sort of first steps that someone should take if they feel like maybe they have symptoms or they might be experiencing some of those things you had mentioned?
They should reach out to their primary care provider. If they don't have one, they should reach out to their health plan and find a primary care provider. Like I said, P3 has many of them in the Valley, and then discuss it further with their primary care. Annual wellness screenings are recommended if you haven't already done one this year. Even if you feel well, go in, do your